Welcome, everyone. My name is Subrata Saha with Grazity Interactive. I'm an account executive with the company, and I welcome you today to our webinar, which is Unlocking the Potential of Your Healthcare Data. With me today, I have David Edelman, and David is a current senior professor at Harvard, and he was the CMO at Aetna in his past career. I also have Eleanor. Eleanor is a veteran in the industry, in the healthcare industry, and she also is a consultant for many organizations in California, and also she's the CEO of her own consulting firm in Ohana Healthcare Partners. So with that, as I said, I'm really excited for the webinar today, and the reason being that when we were preparing for this webinar, I think we, discussed all the ideas and the points that we are going to cover in today's webinar, like what it really means to exchange data effectively between providers and payers and every other entity that is involved in healthcare. I think, and I believe that the outcome of this discussion, the innovation that David and Eleanor are going to bring, if we follow them in the industry, it is not going to be magic, but the outcome will be magical, in terms of improving healthcare for our members. So with that, I'll pass it on to Eleanor. Eleanor, thank you again. If you could just say a few words, about yourself, and then, what you really think, where do we have the opportunities and challenges in healthcare data exchange? Over to you.
Thanks, Subrata. I'm really excited to be here and to be here with both you and David. Thank you so much again for this opportunity. I'm Eleanor Castillo. I'm the founder of Ohana Healthcare Partner, as Subrata mentioned. And Ohana Healthcare Partner works with other providers to transform their healthcare practice, particularly with behavioral health. Given my experience with community-based organizations, I understand the day-to-day impact of the changing landscape to nonprofit, community-based health providers. And part of the work includes helping organizations be ready, go through a digital transformation so that they can better utilize technology, better utilize data to support those that they serve. In terms of challenges and opportunities, I think, there's just so many more capabilities today with, different technology. There's a lot of initiatives for data exchange. At the same time, while all of those things are really exciting, giving patients, giving consumers, members, the ability to choose their providers, to be more of a participant in their care, getting organizations to that point where they can actually, support that process is a challenge. The change that's required, the change management that's needed in this process is a transformation, not only within the system, but within an organization as well.
Great. So yeah, I think Eleanor, you were right. So I think when it comes to the gaps that you just mentioned, I think those gaps were always there in every industry. However, this is I'm telling this from the CIO of El Camino Health, who said that although the organization is highly advanced in terms of technology, still they're just at the beginning of innovation. When it comes to patient care or member care, there was a gap 10 years ago. There is still a gap today, right? And she said that all we need to be doing moving forward is, she termed something called ambient listening, and that's going to be very important in terms of filling those gaps between the providers and the payers, so that ultimately the member who needs care, right now gets the care right now. So I think David, if I could now transition to you and say a few words about yourself and what do you think on this topic of healthcare data exchange?
Yeah, that's a perfect segue, actually, Subrata, given what I'll touch on. So I was Chief Marketing Officer at Aetna. I now teach marketing at the Harvard Business School, and I do a fair amount of advisory work with both small companies, large companies, mostly in the healthcare area, all around how to change the way they operate to take advantage of new AI and digital capabilities. a lot of which is how to really dig into your operations and become much faster cycle, test and learn, using the tools to come up with lots of variations, figuring out which things work for which people, and eventually trying to personalize the way you interact with, in the case of, let's say, Aetna, with your members of your health insurance plans. One of the things that we worked on a lot was trying to get members to take healthier actions. If we could get our members to do the right thing for themselves, they're healthier, they save money, we save money, everybody wins. And we had about 50 at least different actions that people could take, ranging from staying on their meds to using a urgent care facility that's closer to them than the emergency room in a hospital. For a lot of things, you don't need to go to an emergency room. And so we tried to pull together as much data as we could from our interactions to figure out the right way to get each person to take the best action for themselves. And so we knew who we wanted to have to do something. We knew what we wanted them to do, but we didn't know how to get them to do it. So we had to test and learn and test and learn. And gradually, two things became really important. One is the actual act of testing and learning and figuring out what works for whom and having the technology to pull that data back, but also the data that we had to use and how timely it was. And one of the things now about data exchange is that we can presumably get faster data moving around about an individual to those parties whom the individual gives permission to get that data. And so instead of waiting for a claim, which Aetna would have to, which could take 2 weeks at least sometimes to get a claim, if there were data exchange much faster between the providers and the payer, we could get triggers way faster and much more relevantly to get people to take quicker actions, such as after a discharge in a hospital or following up from a particular visit. And so those are all things that you can now start integrating. It takes work. You've got to integrate that into your databases. Then you have to figure out how you're going to use that data to change the way, in my case, you're interacting with an individual. But the potential is there. And from the programs we were already running, we saw significant opportunity, significant margin growth. And we helped thousands of people do the right thing from a health perspective. So I'm very excited by the potential here of data exchange to enrich the patient experience, member experience, depending on your point of view.
Yeah, I mean, David, as you were talking, I was thinking about, the members and their experiences and how their experiences will be directly impacted if providers and payers were to share information. Right now, I think we can all resonate with the experience of having to go from provider to provider, repeating, your journey, repeating the issues, repeating your history, and feeling that the care is disjointed. The members should not be the ones responsible for communicating to other providers what is needed in terms of treatment, but they carry that burden of coordinating for themselves their own care. And if not them, then there are some other family members that are taking on that responsibility of care coordination. So this goes beyond, just a single member's experience. It'll, affect the whole network of caregivers, to any individual. But, being able to go from doctor to doctor, knowing that they have that information, right? And they're just building on more and more information is really going to feel like they're getting the best care. They would feel like they're getting comprehensive care. And so, movement towards whole person care, truly not just in concept, but in practice, is going to be really enriching from the consumer's perspective. From the provider's perspective, for providers to get alerted, for example, if someone went into the ER, we could be another resource, if you will, to the emergency rooms. We could be part of that discharge team to ensure that the care is there when they leave that particular facility. So again, from the in terms of care coordination, access to treatment, quality of care, there's just so many benefits to data sharing.
Absolutely. So I'm so excited for this topic when it comes to, when David said communicating with the members at the right time, with the right messaging to take, best action for them. And Eleanor, you talked about, the care gap or the family members and all that stuff. So, I wanted to share just two examples very quickly. Few weeks ago, I forgot if it was Halloween or Thanksgiving. I forgot to buy something that my son wanted. Until the last moment. So I buy that, I think in Amazon or some other site, and they ship it to me, they deliver it to me the next day morning from the local warehouse. So that's one example. So I have the product, they listened to me, they sent me what I needed exactly, even before the time I needed that within less than 24 hours. And then I read that Amazon even doing, like a drone delivery. I think they're already testing that. The other example is back in January. So I have a bad neck for about more than 10 years. Back in January, I was looking for a specialist. I spent about a few hours making calls, websites, phone calls, and I gave up after a few hours because I have my job to do, right, in the whole day. And I gave up and I forgot about it. Till today, we're at the end of the year. No one reached out to me, and and I'm scared to make that effort again to take an appointment. I mean, thankfully, I live in an area where I have an ER. So, the worst case or the best case could be if something happens to me, somebody will come and take me to ER, right? So these are I think, what I'm trying to share here is that every other industry has transformed. Whereas in healthcare, I think due to security, due to volume of data, or due to regulations, there's so many aspects to it. Even then, I think until we all work together, which we are calling it a data exchange, or we bring all the partners together, I think that's the way to go to improve healthcare. And I can't wait to get to that stage for all the amazing providers and the payers that we have around us.
Yeah, no question, Subrata. And one of the big factors in healthcare is the fragmentation across all the different parties and all the different systems that they use. That's one of the reasons why the government has started putting out mandates for APIs by which information needs to be exchanged, first among providers, then providers to payers, mostly for Medicare and Medicaid, and eventually expanding. But the APIs alone, just given your example there, that's not going to be enough. You need to have the systems that pull in that information, that integrate that with the rest of your database. You then need to have other things that you're going to digitize, like your scheduling. I mean, you said that, just simply setting up scheduling and being able to move information about a patient into a scheduling system that can triage who to schedule sooner versus later, which are more urgent versus not. All that intelligence exists, but you got to set up your systems to do that. And you've got to accept that you're going to have processes that are going to be based on that. And that hasn't been a priority. And it's interesting because we did research when we were working on changing the Aetna brand to be much more consumer facing, that people felt healthcare made them feel like they were in a pinball machine, that they were just bouncing all over the place. And what they wanted was a guided journey. And interestingly, we found that people expect either their primary care physician or a specialist or even their insurance company to be that guide. Even the insurance company, because they said, you guys have all the data, because it all comes in terms of insurance claims. So what are you doing with that? Well, those claims come in late. They're not necessarily as robust with information. So there's opportunity here, but we also have to think about it's not just government setting standards. We have to change our operations. We have to set up our systems to get that data. We've got to integrate that data. Some of those are things that I've seen, for example, Graziti do with clients, be able to create dashboards that help inform people about what's going on with their patients. But this is what has to happen if we're going to take advantage of that data.
Absolutely.
Sure.
So
Go ahead.
Yeah, David, you mentioned AI and API and the operations and the technology. You know that a few weeks ago I learned about that scheduling AI from you. So thank you for that. And I follow every article that you publish on LinkedIn, and I follow every article that you publish from Harvard in LinkedIn. It's very enlightening. Yes, when it comes to Grizzy, we I would also like to mention that so we are a healthcare IT services partner. We are HIPAA certified, and we work with clients in many different areas. But when it comes to data, and I just remember something about AI that I heard from somebody, that your AI is as good as your data, right? So when we work with our clients, we don't need to do anything, we don't need to build really anything fancy right away. We actually recommend that we start with the data that you already have. If you know Subrata as a member, do you communicate with Subrata when he needs help, or to prevent him from getting diabetic, or reminding him for a yearly checkup? And that will, as you said, that will reduce the cost, that will improve the quality of the care, that will improve my satisfaction as a member. Like everywhere we talk about customer experience, and here we do. I really, like to use the word member experience more and more, as we move forward in that operational technology transformation journey that we help our clients with.
Eleanor, I'm curious, from your experience in behavioral health, where have you seen companies starting to make real changes in how they're using data?
Yeah, a lot of companies are looking at how I would say value-based contracting with payers is really a driving force in getting organizations to really change how they use data. And going back to a comment you made earlier, though, David, for them to get even to that point of recognizing that value-based contracting will change how they operate. And if anything, that being an impetus to really embracing data and recognizing that they need a data culture within their organization is really a key thing. Having the leadership, as you mentioned, having that structure, going down a path, deciding to embrace technology, needing to make all these internal infrastructure change takes leadership around that. The desire and the willingness to put effort to prioritize, those things, so that organizations are still around providing services that they currently do today. But looking at data differently in terms of what data they're receiving, how they develop the infrastructure to consume more data and utilize that information, whether it's to improve care, to decrease costs. Those are all the things immediately that people are looking at. Understanding how to structure their staffing patterns, what profile or what staffing pattern would I need to get certain outcomes in the most economical way. Those are key questions that, or what I would say, more advanced organizations are doing with their data.
Yeah, and on the payer side, the flip side of value-based care is, for example, the Medicare Stars program. So Medicare Stars is where the government gives you a rating of stars that you can use for marketing and special privileges, but also cash bonuses for higher stars performance, which come from better health outcomes and more satisfied patients. And getting those better health outcomes means moving data around, having contracts with providers who are providing value-based care that's oriented towards outcomes as opposed to fee for service, knowing which are the providers who are providing better care, and providing intelligence back with your provider partners as a payer on who could use a follow-up and faster information you may have, because the insurance company may know about things that are happening with a patient that a provider doesn't, because everything comes into the insurance company because they see the claims. For example, an insurance company might know that a prescription wasn't filled, that a provider wrote. So that's something you could share with the provider for them to follow up. So why didn't you get the medicine? So there's a lot of opportunities here from working together. But again, you got to have the processes and the strategy to make those kinds of things work. I do think the incentives now, because of value-based care for providers, for Medicare stars and such for insurance companies, do provide a lot of incentive to manage care, and it moves us away from just paying for procedures, for tests, for things like that. It's a big change if it can happen, but it's going to be very hard for all the parties involved to manage if they aren't really smart and have really good data about it. What works, what doesn't work, what's the best way to treat a patient who has XYZ. I mean, those are the kinds of things that we can now start deriving.
Absolutely. So I think, you remind me of some of the interactions I had at NCQA a few weeks ago. So they do this star rating, that I just mentioned. And, all they talked about for 3 days and, is about how to improve data quality that they already have, right? And when it comes to data quality, and I was mentioning that we help our clients at every step of their data maturity, right? So we cleanse the data, we analyze the data that you already have, and then go from there. But anyway, my point was that there are many organizations who do a great job. They spend money on technology operations, but their star rating is still under 3. Or even I've interacted with, providers, interacted with payers that are in the range of 2.5 or below. And they want to get to that 4 and 5 level so that they can be, they can grab more market, for their amazing care that they provide to the members, right? So every provider is aiming for a higher star rating. And as you just mentioned, that star rating is all about the quality of care or the member satisfaction, the quality of care that I receive, as a member. And my feedback has a lot to do for a payer to get that star rating. So that's where I think, we got to innovate. And as you said, putting the right processes and the operations in place so that we understand the data that we already have and do those little things, fill those gaps in terms of improving that experience for the member.
Yeah, one of the most important ways of doing that is to actually pick use cases. So where do you begin? We talk, in rather nebulous terms, improve care, use data to improve care. But for every organization, the priority is going to be different kinds of use cases, different patient situations. Is it, for example, managing discharge out of a hospital for a chronic care patient or for hip surgery, or is it somebody who goes to the ER with behavioral health issues and then you want to manage them? So depending on your line of business and the priorities, start thinking about where is there opportunity to both improve care and lower cost. Use that as the priorities and start focusing the data and your operations on those use cases, because otherwise you're just all over the place. So you need to set operational things that you're going to do, connections that you're going to have between different parties, information you're going to move, and line that up so you start seeing impact. And along the way, you'll learn how to use the data and turn it into action. But you do have to dig in and set priorities. And I think one of the ways people stumble is they just think, oh, well, we're just going to integrate all this data and then we'll do stuff. But people don't work that way. They have to have much more focused priorities. So I've definitely seen that as being a lot more effective.
Yeah,
I definitely agree, David. Having that vision and having a strategy specifically around this is really important. And you're absolutely right. I mean, a lot of the use case is driven by who they are as an organization, right? Their mission and their strategy. And oftentimes what I'm seeing is a key component in taking that strategy into a business plan and actually executing on that business plan is, do you have the right skill set? Do you have the right competency within the organization? And with something like this, and with a transformation, this is where organizations need to partner with people, with organizations that have expertise, such as, Graziti, to help them in this space. Because trying to figure out how to change your current business incrementally is not going to move the dial to become, to operate in this new space.
And as you're doing it, you want to be able to understand how it's progressing. So, as you're rolling out a use case, another area for getting integration is creating dashboards and feedback, stuff you guys,
Yes.
Graziti, do well, so that you can actually track improvements and you can try different things, because who knows what the best way is to manage somebody upon a discharge for XYZ who's in a specific geography and has certain characteristics. You got to test and learn. And you want to try different things and figure out what is the best thing that works. But you need the data feedback in order to do that. You need to have it all instrumented so you can track it. And this is where often you're going to need a partner to get that done.
Absolutely. So you mentioned about dashboards and, really your population health or the healthcare data, or even, the dashboards in the financial side of your operations, right? So be it your revenue cycle, or be it your population health, or even executive dashboard that all the decision makers need in an organization. So quickly you can go to graziti.com/services/healthcare to see some of the work that we have done with use cases and the dashboards that David just mentioned. Little segue from here, David and Eleanor, and I think this question would be for both of you. What are some of the clear, measurable actions that we can take in order to achieve better care for our members?
I'll start. I mean, one of the very specifically is setting up a end-to-end design for how you want to manage the communications to a customer, the expectation of a follow-up action by that patient, let's call them. How, if they respond, are you going to provide them with, how are you going to empower them to get something done or educate them? And what's going to be the measurement on the back end to see if they did it and what the outcome was. So in many cases, it's about education. People don't know how to best take care of themselves. It may be access. For example, one of the things we do for some of ours is give them a list of urgent care centers within 5 minutes of their house that are in network on a map. How's that? They don't have that. They don't know. And they don't know that they can go to an urgent care center for all of these different things that they might have gone to an emergency room for. So educating people is really important. We even did things like provide people with personalized videos. When they became a new Aetna member, we gave them a video that said, Subrata, this is the health plan that you have now purchased. Here's who's covered. Here's which people in your family have primary care relationships. Here's who don't. For those who don't, here's a bunch of them in your neighborhood who are taking new patients and are in network. Click here to make an appointment. I mean, so make it easy, make the flow something that they can do. We've seen that work. But what you got to do is pave that path. They don't want to be in a pinball machine. They want a guided path.
Absolutely. And that, effective communication, although a lot of the providers do it, a lot of the payers do it, I think being consistently doing it is the key. Like, do we have a setup? I get emails, I get letters for my wellness checkups and for my, wellness for myself, my family, but do I consistently get it? Right? So, or it's just a one time or a two time thing. I'm getting too much care for my payer this year, and the next year, they don't even know that they have to remind me for something. But anyway, so I just got driven a little bit. But Eleanor, to you, please.
Yeah, I think for providers, one of the things, we kind of mentioned this a little bit about, really having that strategy. And I think a lot of providers have that strategy. It's a matter of executing on it. How do you really execute a business plan to achieve your strategy? I think is where they could really use some support. I would start with understanding what you currently have, what capabilities you currently have from the technology standpoint, from the people standpoint, from the leadership standpoint, to what is it that they need to do to operate in in a place where they can compete for value-based contracts, provide whole person care so that their members have optimal experiences. And really, again, making sure that their business plan helps them to achieve that. As you mentioned, David, if organizations are not there, then no matter how much data is available to them, they won't have the capabilities to consume that information, much less than use that information to take any kind of action, whether it's business, operational, or care-related action. So I think, again, getting an understanding, aligning that strategy, the business plan, understanding where they are, being very clear about where they need to go as an organization, what capabilities they need to develop, and developing that system really from the member's perspective, right? I think that's a theme that came out in our talks, that if we focus actually on the member's experience, your HEDIS scores will go up, your STAR scores will go up. So if you design your services along with the member's journey in mind, then all of those other things I think would be ancillary.
Excellent point. And, I really like your, action item for really understanding our own technology, right? So what we always recommend to our clients at Grazity is that when we are talking, when we are engaging you for potentially building some processes or technologies for you, we ask that, can we do evaluation, no obligation evaluation of your tech stack? Can we do, and sometimes we call it like a, health check. We do it for Salesforce, we do it for their, marketing automation, we do it for their overall cloud technologies and the transitions. So we always start with an evaluation and a health check of the technologies that they have currently, and then assess where the gaps are and what can be done within the technologies that you already have, so that you optimize your cost. So we don't recommend that you just buy another technology while not even making sure that your existing technology can do a much better job. If they.
So I think just in terms of wrapping here, there's an imperative to improve patient outcomes at lower cost. We all see that the trend lines in the cost of healthcare are just unsustainable. Unlocking the data that's now gradually becoming available through data exchange is a great asset to help you do that. It could be jet fuel, but you still need to make sure you got a plane. And so it's the combination of that data along with the strategies and the processes and the priorities for how you want to actually help consumers. And I do think actually with AI capabilities that are coming, it will be easier. I mean, you can generate lots of different options of messages to test, for example. You can point AI towards your database to more quickly find people who are having challenges that you should act upon. We can find things in the data. So all this will be there as long as you're aligning your system to take advantage of it. So there'll be companies that do, and there are companies already moving towards that. I think it's just going to be a real step up in terms of turning an organization into one that is fueled by data and intelligence versus one that's just fueled by knocking down the cost of our operations.
I completely agree, David. I couldn't say it any better. And I would say the organizations that do that are the organizations that are the provider of choice for both the payers as well as members.
Yep, that's right. And jet fuel and plane. I love that, David. So we're at top of the hour. Thank you so much, for your time, David and Eleanor. I'm really excited to carry and continue this discussion. And, together, we can impact, the outcome of, some of our partners that we work with, right? So, with, all the best to everybody. And thank you for joining us today. Please write to us, connect with us on LinkedIn. Please follow David and Eleanor, and of course, Grazity. If you have any question, we'll be more than happy to get back to you.